Have sleep apnea and is using your CPAP machine difficult? Premier Sleep Solutions dentists can help by fitting you with a custom oral appliance. Oral appliances are like mouthpieces or bleach trays, so they don't require a mask or hoses, and they can be as effective as CPAP devices. Since most insurance companies and Medicare cover these appliances, patients' out-of-pocket expenses are minimal. Call Premier Sleep Solutions today at 949-326-5200 for a free sleep consultation.
Back. Well, if you're someone who thinks that you may suffer for sleep apnea, or maybe your spouse thinks you do by all the snoring that happens, we have Dr. Shad Morris on. He is a member of the American Academy of Dental Sleep Medicine and the CEO of Premier Sleep Solutions. Welcome.
Thanks for having me on. Again, nice to be here.
It's nice to have you on here. We were talking a little bit beforehand about I was asking something I did not realize is that many years ago I went to one of those sleep study things and I turned out to be okay. I don't have sleep apnea, but I started out by going to what you would call ear, nose, and throat doctor. So I was surprised when I saw the dental part of this. So first explain how that relationship works.
Well, that's great. I'm glad that you had that experience and you were screened. That's definitely something we recommend that people get screened, because some of the symptoms would be, fatigue, just don't have the energy that you've had before, snoring is a problem, or maybe memory loss or things like that can be related to sleep apnea. So if you've never been tested for that, going to a board-certified sleep doctor, which could be an ENT, it could be a pulmonologist, it could be a neurologist, as long as they're board-certified in sleep, can test you for that. Okay. And then once you're tested for that, then they make the diagnosis. The American Academy of Sleep Medicine, like we were talking about, in 2006 came out with the guidelines. And if you have moderate or mild sleep apnea, that means that you stop breathing under 30 times a minute per hour all night long, then you're a great candidate for either the CPAP, which is the mask, or the oral device that you can see here to treat your sleep apnea.
All right, very good. So tell me about your company, Premier Sleep Solutions. How and why did you start this? And did you start out, were you a dentist beforehand, practicing that and then moved into this?
That's a great question. I own two very successful dental practices, and I've been I've been treating dental sleep apnea for more than 10 years. So I was incorporating that into my general dental practice. Actually both of them, and then I opened a separate practice where all we do, this was in St. George, Utah, where all we did was make the appliances that you see here on the screen. Well, we figured out how to be very efficient at that, and we realized that medical insurance, and I got my Medicare provider, will actually cover the appliance. So I sold my two general dental practices, and now we've opened 4 locations where we just do this. So we're a boutique practice, specializing and focusing on treating snoring and sleep apnea with our dental devices.
Okay, and your place that's close by here is on Dove Street in Newport.
Yes, Dove Street in Newport.
I know exactly where that is.
Right, 2 minutes from the airport, which I'll be flying out of here later today. But great location, easy to find. Patty is one of our staff members there. She's been in the industry for 20 years. So she knows sleep medicine, dental sleep medicine, probably better than anybody around.
So let's get to the base of this. What is sleep apnea? What's going on, basically?
So basically what sleep apnea is it's an obstruction here in your throat. And it's really when you stop breathing for 10 seconds or longer. And what they do at the study is, you sleep all night long and you get the number of times that you stop breathing for 10 seconds or longer. So 5 to 15 is considered mild, 15 to 30 is moderate, over 30 is severe. Now remember, that's 10 seconds that many times per hour. So that's a lot of times that you stop breathing.
Right.
And you can just imagine the health effects that it's having on individuals. If you were to hold your breath for 10 seconds, and a lot of these go longer than 10 seconds. Some of them are 30 or even 60 seconds before the brain says, hey, I'm not getting any oxygen here, the heart starts pounding, leading to heart problems, AFib, high blood pressure, all trace back to sleep apnea because of the lack of oxygen. There's no oxygen getting to the brain, which can contribute to susceptibility of stroke and heart problems, and it's linked to diabetes as well.
What causes this? What is actually happening in the airway? Is it, like many things, as you age, things aren't as tight as what they were
Yes.
for lack of a better term?
You're exactly right. As we get older, and I'm getting older as well, gravity takes its toll on us.
Yeah.
And our skin isn't tight, our muscles they lose their elasticity, and then they become more elastic, and so things collapse more. And so it's really your tongue. You see a small portion of your tongue, but your tongue goes way down here, and usually what happens is your tongue falls back and blocks that airway. When it's partially blocked, that's when you hear the snoring, okay? That's why snoring is a symptom of sleep apnea. When the tongue completely blocks the airway, that's called sleep apnea. And 34,000 people a year actually die in their sleep from sleep apnea.
Wow.
Now, that's not a bad way to go, but it can be prevented.
Yeah, exactly. With a lot of things, within different kinds of disorders and diseases and things, often you look at someone's weight, if they have diabetes, maybe smoking, all these types of things. Do these things play into this as well?
That's a good question. Weight does have some factor in this, but you would be surprised of the number of underweight people that we treat.
Wow.
So it's more related to the anatomy of your airway, and everybody's is individual. And so the smallness of the airway and the size of the tongue and the back of the throat is is probably the biggest factor in causing sleep apnea. It is genetic. I was just talking to the gentleman before we came on how his several family members in the family all have sleep apnea. So there's a genetic component which makes me go, okay, then it is a lot of anatomy. Now weight can add to it. As you gain weight, then your neck gets bigger, and it can make it worse.
Okay, we want to talk about today, in the time that we have left here, about the oral appliance. We have it on the screen versus we've seen like an oxygen mask in the tube kind of thing.
The Darth Vader mask, we call it.
Exactly.
Now, that's a great treatment for those people who can use it. And our goal is to treat people however it's going to work best for them. Now, we know the stories and the research on the mask is that only about 40% who get it can actually use it. So if you've been diagnosed with sleep apnea and you're in that 60% that can't use it, we have the oral appliance, okay? It's custom fit, so we take molds of your teeth, and then basically what we do, this is the Herbst appliance, is it anchors to your teeth and keeps your jaw from falling back, which keeps your tongue from falling back and keeping that airway open. So we put it in a natural position so that you can breathe naturally through the night. And that's what this does.
Is this similar to what a retainer might be?
Yeah, you're exactly right. This is very similar to what kids get after their braces.
Okay, and obviously he knows what retainers are.
Yes, thank you.
That was his practice beforehand.
Yes, I did a lot of orthodontics. So, in fact, the Herbst here, I can't mention enough that Medicare does cover this because, why do they cover it? Because I think healthcare is going more preventative, and they're preventing the heart attacks, the strokes. They're preventing all these things because they know that 90% of the people that get this will actually wear it versus the mask. That's why Medicare covers it, because they know they're going to save a lot of money in health-related costs. So it's custom fit to the patient, and then the actual bar here, there's several different models that we can make for our Medicare patients, but we can incrementally adjust them forward. And then once the snoring stops, then we know that we're pretty close to keeping the airway open. And then we like to do a final sleep study with the board-certified sleep physician to know what the number was before and that we're treating the person effectively. We like to know the subjective symptoms. Hopefully they're feeling more energized. They have more energy through the day. They're not falling asleep while they're driving or sitting in their chair. And maybe there's some effects on their blood pressure and things like that. So those are subjective, but we also like to have the objective numbers, meaning they started with a 30 and now they're down to a 5. We go, that's success.
All right, very good. Well, if you're interested in this and would like to talk to Dr. Morris, please call him. This is the number. I saw there's a different number on the ad than this. Is this the correct number, 205-7740, the one that we have up?
949?
Yeah, the one that we have up right there. That's the number that we had on our sheet here. Is that a correct number?
I believe that is the correct number,
okay.
yes.
There's a slightly different one that's in your ad, but I'm sure they both go to the same
yes,
place.
we have several different.
Okay, I want to make sure we got that
thank
number
you very
correct.
much. Yes.
And it's
go to
great
our
have you
website
on.
if you have any
premiersleepsolutions.com. Just remember that. We have that listed there as well. That's probably the best place to go first. And next time you come on, you can bring one of those appliances. We'll take a look at it.
Yes, I will be back. Love to be back. Everyone here has been great to work with.
All right, a pleasure to meet you.
Nice to meet you.
Nice to meet you.
Thanks for coming.
We'll be back in just a moment.
Do you have sleep apnea and is using your CPAP machine difficult? Premier Sleep Solutions dentists can help by fitting you with a custom oral appliance. Oral appliances are like mouthpieces or bleach trays, so they don't require a mask or hoses, and they can be as effective as CPAP devices. Since most insurance companies and Medicare cover these appliances, patients' out-of-pocket expenses are minimal. Call Premier Sleep Solutions today at 949-326-5200 for a free sleep consultation.